From the News Channel 5 Network, this is Medical Mondays.
Good evening, everyone. Welcome to Medical Monday right here on News Channel 5 Plus. I'm Casey Mason, and tonight we are talking about the advancements and just better understanding that outpatient knee replacement, the procedures that go along with it, the surgeries, the techniques. And tonight you are in for a treat because joining me here this evening, I have got Dr. Thomas Gautsch joining me, and a treat later in the show that we are going to save for you later on. So, Doctor, thanks for joining us this evening.
Well, thank you so much for having me, Casey.
So nice to meet you on our Medical Monday. Now, this is your second time joining us, right?
It is, yep.
Wonderful.
I was here a few months ago.
Okay, wonderful. And let's go ahead and kind of dive into this. Tell folks about tonight's topic, why you're visiting us this evening.
Well, the last time that I was on, we had a number of callers, and at the end of the show, they asked if I might come back another time, and actually asked if I might bring a patient with me also, somebody who had been through it. It's been, actually it may have even been as much as 6 months now since I was here last, and there was an opportunity. They called, and I said, of course.
Again, we actually, later on the show, we are going to bring in one of your very own patients that you have done not one but two procedures on, correct?
Correct, yes.
Yes, her name is Tammy, and she's going to join us and kind of give us a different perspective. We get to talk with, medical experts like yourself, and sometimes it's just nice to hear from someone who's had the surgery and been through these procedures.
That's right, because you want to keep it real.
That's right.
If somebody's going to be a patient, there's nothing like talking to somebody who's already been through it.
Exactly. And of course, on our Medical Mondays, we're always so excited to hear from you. If you have any questions, maybe even some stories that you want to share with us, some commentary, feel free to call in tonight. We'd be more than happy to take your call. I'm going to go ahead and give you that number just to start things off tonight. Here at the Plus, it's 615-737-PLUS. Again, 615-737-7587. So we're happy to talk with you tonight. We'd love for you to call in. But first, let's get to know you, Dr. Gautsch. Tell us about your history, where you're from, and how you got here into the medical field today.
Well, I practice just on the north end of Nashville, just outside of Nashville, in a town called Gallatin, which is in the suburbs of Nashville, sort of. I came here from Los Angeles, actually, where I was at UCLA. And before that, I had trained at Johns Hopkins, and it was kind of a roundabout way. Before we started, you were asking me sort of how I made my way to this position. So I'm a shoulder and knee surgeon, pretty much exclusively. Orthopedic training, did fellowship and as well as additional training in sports medicine. So I'm actually double board certified in orthopedic surgery and in sports medicine. And I also did a fellowship in total joint replacement. But if I look back on it, it all goes back to when I was a teenager. I was athletic, not very good, but I was athletic, and I had some injuries. And like most of my colleagues, I have scars from surgeries that I had when I was a teenager, and then again in my 20s. And that's fairly common. Orthopedic surgeons have almost always had some brush with orthopedic surgery when they were younger. And that sort of set me about thinking that maybe I wanted to be a doctor someday. But there hadn't been any medical people in my family, not doctors anyway. There'd been some nurses. But it was always in the back of my mind. I went off to college and got a degree in engineering, and enjoyed the engineering and the math and the science part of it, but still had this love for biology. So I managed to get a degree in bioengineering, which was combined biology and engineering. And that actually put me into contact with orthopedic surgeons again. There's a lot of mechanical things that go along, and a lot of research and biomechanical research is taking place in orthopedics, and ultimately led me to joint replacement as a love. So I did research and was fairly successful, managed to get a scholarship to go to Johns Hopkins, and went and did medical school there. Used my bioengineering through my medical training as well, and then thought that I would be a professor of orthopedics ultimately. Got on that academic track, which took me to UCLA, where I was for 6 years. And then a terrible thing happened, really. From the standpoint of my professional career, I started having children, and that reoriented that kind of changed my perspective on what I thought was going to be important in my life. And so the kids became the important thing, and I realized that I wasn't seeing as much of them as I really should and wanted to. So I had to make a decision. And what I ultimately decided was to leave academic medicine and go and find a nice place in the country to raise the family.
what better place than Middle
Well,
Tennessee?
we've been here for now 22 years almost, 21 and a half years.
And now, where is your practice located so folks can know?
It's in Gallatin.
Gallatin, wonderful.
So it's about 20 miles north. Took me about 20 minutes to get here today.
Great, and then later on the show, we'll give folks some information how they can, reach out to that location there, and maybe if they have any additional questions, we have a referral line we'll give you later on in the show as well. I think it's nice, you're going to be hanging out with us for the next hour or so. It's always good to let folks know your history, kind of what led into the field that you've entered. Obviously, something you are passionate about, so we're excited to get to a lot of talking points tonight. One of the first things I want to talk about is what exactly is this, outpatient total knee replacement? What is it? What does it mean?
Well, that's a big question. I'm going to answer it a couple of different ways. So the first thing is, what is a knee replacement? What I find a lot of times in talking to patients is everybody knows somebody who's had one, but not very many people really understand so much what it is. In the old days, there used to be a lot that was removed and put back, but in 2018 now, 2017, 2018, a modern knee replacement is really a surface replacement. So we don't take out the whole knee. We basically go in and put on new surfaces. It's a lot more like getting a crown on a tooth is than it is like getting a replaced car or a whole new heart or something like that.
Yeah, it's something too that earlier when we were talking, this is something that's traditionally performed as an inpatient procedure. And as far as we've come, just the medical advancements and whatnot, there are several reasons why. That's obviously a surgery that took place in 2014, one of your first ones. Kind of take us back through the history and how this procedure has really evolved to become so much better as it is today.
Sure. So knee replacements have been being done since really the mid-70s, and there were a number of advancements took place early on. Those were mostly mechanical kinds of advancements. So they were materials and designs and surgical techniques and things like that. Through the 80s, it started to become fairly mainstream. In the 70s, it was pretty experimental. In the 90s, they really kind of took off and became fairly popular for older people who weren't super active to help them get walking again, typically. Through the 2000s, of course, we've now got people my age and a little bit older who, as a group, tend to want to be much more active. We're into many more things, and because of sports and other activities, people have worn out a lot of joints. So, but the technology has continued to advance and has gotten to the point now where we can do it as an outpatient.
Wonderful. We actually already have some callers on our lines tonight, so I'm going to go ahead and take our first call. Good evening. Can you hear me tonight?
Yes. Hi.
Wonderful. Hi. What's the question you have for us tonight? Thanks for calling in.
Well, actually, I have two questions. My question primarily involves, I've not had knee replacement surgery, but I have had a broken patella, so I'm wondering if I'm in increased risk for the total knee replacement, and if it would be as effective as if I hadn't had anything wrong. But specifically with regard to the patella, I'm probably the only person you'll ever meet who's actually broken both of them on separate occasions, and one surgery went considerably better than the other one in terms of the size of the surgical scar. But beyond that, I noticed a few years after the surgery on the one knee rather, and just recently I have developed in my foot a stiffness, and I've got the full range of motion of the foot. It's just that it just feels extremely stiff. So the first thing I did was went to my primary care, knowing that she would have to refer me, and she said, I'm not in any pain or anything. So she said, I don't know who to refer you to. She said, it might be like a podiatrist or something, but I'm wondering if this several years later could be a complication of the patella surgery.
All right, thanks for calling in. Yeah.
Great. So those are some very good questions. And as I mentioned, I've been doing what I do now for more than 20 years. And so actually I've seen several people who have broken both patellas, sometimes both at the same time, which is obviously a horrible thing. I'm glad that it sounds like you're doing pretty well. One of the things about a patella fracture is that usually that fracture will go and disrupt what we call the articular surfaces. The impact and the force that it takes to break the kneecap damages those smooth surfaces that ordinarily give the glide to your knee. So over time, even if it's a well-done surgery, even if it heals well, the knee will start to become arthritic. I mean, it just sets this process of wearing out and arthritis in motion that's kind of unrelenting and just progresses. So it's very, very common that people who have had patella fracture later develop arthritis in at least that part of the knee. Now that can have secondary effects. So it can start to affect other parts of the knee. It can make you start walking funny. You didn't mention it, but if anybody ever asks you why you're limping or tells you that you have a limp or you walk funny, that can start to affect your foot, your ankle, your hip. I mean, it's all kind of connected in what we call a kinetic chain. So it's not uncommon that people will come and see me with bad knee problems and say, by the way, I'm also having, and it's because secondary things they're compensating or trying to.
Yeah, it's all really connected.
Right.
One's going to affect the other. It's a chain of events.
That's right.
We have another call that we're going to get to right after the break, so stay tuned. We'll be right back.